Medicosis perfectionalis is back. Let's compare among skeletal muscles, cardiac muscles, and smooth muscles. Voluntary, involuntary, involuntary. Striated, striated, non-striated. If something is striated, it means it's made of sarcomeres. What the flip is a sarcomere? Let me explain. Here is your muscle. Each muscle is made of fascicles. Each fascicle has muscle fibers. This is a singular muscle fiber. If this is a skeletal muscle, each cell will have many nuclei. This is multinucleated. And then each muscle fiber is made of muscle fibrils. And then the fibrils are divided with these lovely Z lines into sarcomeres. Sarcomere, 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 another sarcomere. Sarco, flesh. Mere, piece. A piece of the flesh. And this is made of myosin and actin. Myosin are thick fibers, actin are thin fibers or filaments. Muscles are striated or smooth. Striated are either skeletal or cardiac. The smooth are non-striated. Voluntary, involuntary, involuntary. Somatic nervous system, autonomic nervous system, autonomic nervous system. Multinucleated, uninucleated, uninucleated. The cardiac myocytes are branched. They have gap junctions. That's why the entire ventricles, for example, can contract together as a singular syncytium. In one of my physiology videos, I've told you the difference between motor and sensory. If you divide the brain here in the midline, most of the things in front of the midline are motor, most of the things behind that line are sensory. The same flipping concept applies to the spinal cord. Front, motor, back, sensory. Okay, medicosis, so if I want to go and supply muscles, is this a motor function or a sensory function? You want to supply muscles, this is motor. Okay, but we have two types of muscles. Some of them are voluntary, others are involuntary. If they are voluntary, they will take somatic nerve supply from the anterior horn cell. If they are involuntary, such as cardiac muscles and smooth muscles, they will take autonomic nerve supply from the lateral horn cell. The central nervous system is just your brain and spinal cord. All of the other nerves are peripheral nervous system, and they include cranial nerves and spinal nerves. The cranial nerves are 12 pairs. Some of them are sensory, some of them are motor, some are mixed. But all of your spinal nerves are mixed, which means motor and sensory in the same nerve. Tell me about the autonomic nervous system. What does the word autonomic mean? It means involuntary. And it's divided into sympathetic and parasympathetic. Most students know about this. What they do not know is that the autonomic nervous system includes the enteric nervous system in your gut, which is subdivided into myenteric for the motility of your gut and submucosal for the secretion. Sympathetic versus parasympathetic. Sympathetic is fight, flight. Parasympathetic is rest and digest. Alright, sympathetic nervous system. Let's say you're running from a tiger, you're running for your life. This is your sympathetic autonomic nervous system. Do you think this will increase heart rate or decrease heart rate? If you say increase heart rate, you are absolutely correct. Conversely, how about your beautiful parasympathetic nervous system? It will decrease your heart rate. You are resting and digesting. But let's cut both of these nerves. Oh, you mean you're gonna remove my sympathetic and my autonomic nervous system supply to the heart? Yes, separate the heart from the nerves. The question is, will the heart continue to beat and pump? The answer is yes. Wow, how come? Because the heart has automaticity. The heart has its own generator of impulses, and these are the SA node and the AV node. Can I do the same thing for the gut? Yes, if you remove the nerve supply to the gut can continue to move and secrete by the myenteric and the submucosal plexuses. Then what's the purpose of the outside nerve supply? This is to increase motility or decrease motility. Increase secretion or decrease secretion. But the gut, it's automatic. The gut has its own nervous system. That's why we always talk about your gut feelings, no pun intended. And now to the comparison, skeletal versus cardiac versus smooth. Skeletal, striated. Cardiac, striated. Smooth, non-striated. Let's talk about branching. Non-branching, branching, non-branching. Voluntary, involuntary, involuntary. Multinucleated, uninucleated, uninucleated. Since this is voluntary, it has somatic supply. Since this is involuntary, autonomic supply. Since this is involuntary, also autonomic supply. Autonomy. If you are autonomic, you have autonomy. The autonomy of the heart is by the sinoatrial node and atrioventricular node. The autonomy of the gut is by the enteric nervous system. Troponin is present in the skeletal muscles, is present in the cardiac muscles, but it's absent from the smooth muscles, and it's replaced by calmodulin. This is very important clinically. Let's say that a patient came to you complaining of pain in the chest. Is the pain coming from the heart or is it coming from the esophagus? Is it a heart attack or a diffuse esophageal spasm? Because, by the way, their chest pain is exactly the same. So, how can I tell the difference? You order serum troponin. If this is a cardiac muscle suffering, you'll find tons of troponin being released and dished out into the circulation. But if this is the esophagus screaming, the esophagus cannot release troponin into the serum. See, medicine makes so much sense once you understand what the flip you're talking about. Gap junction, absent from the skeletal muscles, present in abundance in the cardiac muscles, also present in the smooth muscles. Give me examples of skeletal muscles: biceps, triceps, quadriceps, etc. Cardiac muscles, your heart, and the smooth muscles include the muscles in the wall of the stomach, in the wall of the intestines, the wall of the uterus, the wall of blood vessels, etc., etc., etc. Let's review the muscle types from Picmonic. These are the skeletal muscles bound to skeleton, cardiac myocytes, and smooth muscles in your gut. Skeletal muscles, multinucleated. Cardiac muscles, uninucleated. Smooth muscles, uninucleated. Skeletal muscle is somatic nerve supply, the somotic. Cardiac muscles and smooth muscles, however, are autonomic. Skeletal muscles are striated. Cardiac muscles are striated. Smooth muscles are non-striated. If you like this video, you will love my cardiac pharmacology course on my website medicosisperfectionalis.com. Learn about antihyperlipidemics, antiarrhythmics, anti-anginal, antihypertensives, diuretics, and digoxin. Thank you for watching. Please subscribe, hit the bell, and click on the join button. You can support me here or here. Go to my website to download my courses. Go to Picmonic for animated medical mnemonics. Thank you for watching. As always, be safe, stay happy, study hard. This is Medicosis Perfectionalis, where medicine makes perfect sense.